Thank you for having me speak today at your district meeting. My name is Dr. Thomas Eberly. I'm a physical therapist and I'm on the current FPTA Board of Directors, and I was nominated for president this year and I accepted the nomination. So thank you for everybody who voted to have me nominated. My current experience, I have 4 years on the Board of Directors as the Southeast District Director. So I'm the liaison between the Southeast District and the board. And then for the last 3 years, I've also been elected to the executive committee of the board. The executive committee is the president, vice president, secretary, and treasurer. And then out of the 18 board members, they elect one other board member to that position to make it five members. And for the last 3 years, I've been voted by the board on that committee. The executive committee oversees all aspects of the association. So as the Southeast District Director, my responsibilities and purview are mainly within the Southeast District. Wearing my hat on the executive committee, we oversee the 4 aspects of the association, which are the 4 pillars of public relations, membership, advocacy, and practice. We also look at the financials, so that there's a finance aspect to that. As far as my vision for the association, and I know I just have about 5 minutes here to address you guys because you have a busy meeting, so I would like to preface this by saying the nominating committee, Rain Osborne and I did a Zoom interview this morning, and that will be posted by the association. So if you want more details about the vision, my vision for the association in the next 2 to 4 years, please check that out. So, but we have some really tough issues right now in Florida, and the first one is regarding the advocacy pillar as well as the practice pillar. So we became aware that within the workers' comp system, there's specialty networks that act as a third-party administrator for patient care and administration through the work comp system. So the average reimbursement for a workers' comp visit is around $125, $130 if you're seeing them an hour. Well, these third-party administrators are, in many cases, taking over a 50% administration fee. So a lot of providers are getting reimbursed, actual reimbursement, $50, not the $130. And so that's a problem. So we've identified this. We created a task force on the association, which I'm chair of, and working with Tad Fisher, our CEO, and other members of the task force, and with members, we were able to compile some data, take it to the Work Comp Board, and we're currently working with them, with the State of Florida Work Comp Board, to effect some change with this really important issue. Further, in private insurance, it's important to note that administration fees are held to 20% per the Affordable Care Act passed a few years ago. So private insurance is capped at 20%, and we're seeing 50% in this work comp system. Nationally, comparing apples to apples, workers' comp administration fees nationally are 15 to 20%. So we're looking to have that number, around that number, be what's implemented in Florida, and so providers are getting the money that they deserve, the reimbursement they deserve. We also have a practice and advocacy issue regarding copays. So copays, this is something continually as an association we're working on. We've met with insurance companies over the last couple of years. The reality is when you see a general practitioner, you usually only see them once or twice in a month or an annual just for a physical. And if you're paying a $50 or $60 or more copay, that's acceptable. When you see a physical therapist, many times you're seeing us for 2 to 3 times a week, and that can easily get to beyond $500, $600 a month, and that's something that we have to work on, and we will continue to work on. Last month we had an issue, what membership brought up. Cigna dropped their rates down to $38 because they started using an intermediary. The FPTA got involved with that, and so these are the types of practice issues that we need to continue to be on guard for. And we were able to get good resolution with that. The members that were seeing their rates drop, we created a toolkit online, and now that rate is is improving. So another area of regarding the practice and advocacy pillar that's really important is the dry needling. It affects a small number, granted, of our outpatient physical therapists, but it's an important tool that the majority of practitioners across the United States can do in their given chapters, and Florida should be able to practice within our skill set, our training, and so this is something we are going to continue to do. I don't want to speak too specifically on our strategies, but generally speaking, it was a two-pronged approach. We are looking for legislation so that it's a black and white, clear delineation that yes, physical therapists can perform dry needling in Florida, and this is a big education piece. Further, we are having individual members on their own approach the state board and get exemptions. We actually had a member do that earlier this year or late last year. So we became aware of that. So the Florida board can give exceptions, but we do want it as something that all members can do. Further, regarding membership, we really need to grow membership, and this relates to the public relations pillar as well. As an association, as the APTA, the FPTA, we've made progress on social media, but we really need a social media revolution on getting our message out. And I haven't seen that yet within, the APTA and the FPTA as successful as some individual members' campaigns are, like Get PT First. We have Choose PT campaign. It's a great campaign, but as PTs, we really need to maximize social media and getting our message not only out to the general public, but also to our membership. Our message, we need to demonstrate to our non-members how important it is to be members. We also need to demonstrate to them how much value there is. The most common reason we get why physical therapists or physical therapist assistants aren't members is that it's too expensive. We need to show them how it's too expensive not to be a member. And we can do that. I think all of us that members see the value. So we just need to communicate that better, and social media is a great tool for that because it's free. Finally, we need to get the districts a protocol and the technology to create multiple district sites at a given meeting, because our 6 districts are big. Northern's done a good job with creating sub-districts, but we need to be able to leverage technology to allow multiple sites, so we have a live site and then we have other sites Skyping in or using technology to attend the meeting, and that will help, I believe, with growing membership. Finally, for myself personally, obviously we have 18 dedicated, intelligent, highly professional people on the board. This isn't these goals that the association are working towards and have worked towards in the past. There's something all of us are going to work towards. There's dozens of other members involved across the state. We're going to do this together, but I'd like to step up now. It's a good time in my life to lead, and I feel my contacts within working in the corporate world. I worked for Health South, which is now Select. I have a private consulting business where I've worked with a lot of private practices in different groups. I've worked in the hospital settings. I've worked, now I work full-time academia at the University of St. Augustine in Miami. So I feel that I can bring a lot of the different areas of practice together and really leverage all our skills that we have to bring to the table. I'm really optimistic about what we can do in the next couple of years, and I do know that our association is needed to move our practice and profession forward in Florida. So I thank you for giving me a few minutes this morning. Please look for more information on the FPTA site if you want to know more information about me. And please, I've done a lot of continuing education for free around the state to benefit our PAC. If you've seen me present before, you know how strong of an advocate I am and how I can articulate a lot of our positions. And if you haven't seen me present, ask those that know me. I've been very active in the state, and I would really appreciate your vote so we can continue to move forward together. So thank you again, and have a great day.